Well, first of all, I say I'm 75, and at 75, you know a lot of people who've had the same problem. My name is John Price. My wife and I, Jan and I, live in Pasadena. I've been in broadcasting since 1955, starting at small stations in the Midwest, and then moving out here and actually working for quite a while with the ABC radio network. We have one son, a wonderful daughter-in-law, and 3 adorable little granddaughters. My health was very good. A typical yearly physical, and I felt so good that I let it slide a little bit, 14 months, and my doctor said, oh, look at your PSA. It's gone from 2 to 44. You better get yourself to a urologist, and I went several places, but I wound up at Norris.
Mr. Price had a very locally advanced cancer, which had also spread to one of the lymph nodes. So this makes surgery quite challenging, but I believe that that is one of the strengths of our program, is offering treatment for such cancers.
And by the time I got into the operating room, it had gone from 44 to 60.
Many localized prostate cancers are low grade and low volume that can actually be safely monitored. In other words, you don't require any form of surgery, radiation, or medication, but just very close follow-up with PSAs and biopsies. However, what Mr. Price has was on the other end of the spectrum, where he actually needed aggressive early treatment with multimodal approach to best cure his cancer.
We got connected with Dr. Desai, liked him very much. Wonderful combination of professionalism and personality and pleasantness. And I knew that's where I wanted to stay.
So Mr. Price represents a patient whose best care is done in a multimodal approach. So we had a conjoint discussion between the medical oncologist, radiation oncologist, and the surgical team in planning out Mr. Price's care. He first of all received hormone treatments to shrink the prostate gland. We then went in surgically to remove the prostate and all the lymph nodes, including the ones that were involved. And once he recovers, he will undergo focal radiation therapy along with continuing the hormones for best chance of cure.
I mentioned that the day I had my surgery, my PSA was a 60. Since that time, it's been a 0.03, or they insist on calling it undetectable, which I thought was a song that Nat King Cole sang. But in any case, that's where I am now, and that's where I want to stay, preferably for 20, 25 years.